all, this is Archana, Assistant Professor from SNS College of Physiotherapy. So today we are going to have a case discussion on the topic epilepsy. So here we have Anusri from 4th year BPT who is going to share about her case study. So she will share about what is epilepsy, what are the clinical features, what are the management strategy she has followed during her hospital visit. Okay.
Good morning all. Now we are going to discuss about the topic as epilepsy. The person who are affected by the epilepsy, he is a male child at the age of 5. The main chief complaint of the epilepsy is the gazing of eye, upward eye and the tongue biting. These are the two main clinical features which are seen by the affected person. First of all, we are entering into the clinical feature. We can talk about the epilepsy and seizure. What is mean by epilepsy? It is a abnormal electrical activation which is acting on the brain cells. The epilepsy can affect either lobe. It can be a frontal or a occipital. But before entering into the epilepsy, the main feature is a seizure. Seizure is one of the main clinical feature. It is one of the main symptoms which can be seen in the epilepsy. What is a seizure? Seizure is also an abnormal electrical activity which is occurring in the brain. But every seizure, it cannot be concluded as epilepsy. For a single day, there will be a 4 to 5 seizure can be seen by the affected persons. It can be concluded as epilepsy. But once the person is getting one epilepsy per day, or it can be for and it can be maintained for 2 to 3 months, it is not about a epilepsy. It is only a seizure. We can be control a seizure within the medications. Entering into the epilepsy, the patient is about a 5 years. The main problem we faced is about balance and coordination and a speech.
Okay, so while you taken the assessment, do you have any examination procedures you have done?
Yeah, ma'am. The first
diagnose it as epilepsy. Any investigation tool?
Yes, ma'am. The first investigation tool as a clinical feature, we had seen that tongue biting and eyes gazing.
Okay.
The patient is about only 5 years, no ma'am. He had get epilepsy for 24 times per day.
Okay. So the doctor taken any assessment tool to see the brain electrical activity?
Yeah, ma'am. It is it not about anatomical structure disturbance. It is only a physiological, because the doctors concluded that during the weather change, the person's getting the frequent epilepsy, ma'am.
Okay. So what are the other clinical features you have seen?
Other clinical feature, there is a slurred speech because of the epilepsy, and bradykinesia, ma'am. His movement is only very slow, and it cannot be conveyed in a full-fledged manner.
So what you done to treat the bradykinesia?
Oral massage, ma'am.
Okay.
So for a speech, to produce a speech, we are went to the oral massage, and for balance and coordination, bear walking, okay, and beam walking, the straight walking, we had done all those things, ma'am. In this climate, we need to do particular exercise, ma'am. We can't do the vigorous exercise. He can get epilepsy. Now the climate is not good, no ma'am. So we were only basic exercise we were done to that person, ma'am.
Okay, so to improve bradykinesia, you need to do some activities that should have faster rate.
Okay. Yes, ma'am.
So he is having slower coordination. So to improve that, what you all done to like coordination activities?
Buttoning the puzzles making,
okay,
and matching the alphabets with that objects like that, ma'am. And main thing is the obstacles, ma'am.
Then you can also do ball throwing,
yes,
reaching and grasping activities. Then balance activity in trampoline.
Yes, ma'am. We done the trampoline, and we also focus the grass and the fine motor skills, ma'am.
Okay. So anything else you seen after seeing the patient from the initial treatment?
Yeah, ma'am. It's good.
Is there any progress?
Yeah, ma'am. There is a prognosis, speech.
Yes, ma'am. Then
balance and coordination.
According to the functional activity, is there any progress?
Yes, ma'am. There is a progression. Before that, he need someone help. But nowadays, he are independent. While he is walking in a bear walking. We need to be focused on him. But nowadays, we no need to focus on him.
Okay.
He can walk himself.
Yeah, ma'am. Okay. So majorly the epilepsy, what we need to do is in physiotherapy treatment, we need to improve the quality of life and also improve the functional activity of daily living. So this is all about today's section. Hope you guys understood about the case study. Thank you all.
Thank you, ma'am.